Hello guys, today we'll be talking about syphilis and we'll be talking about syphilis under the following headings: introduction, causative agents, pathogenesis, epidemiology, risk factors, diagnosis, prevention and control, as well as treatment. What is syphilis? Syphilis is a chronic, systemic, sexually transmitted infection that is caused by the spirochete bacterium Treponema pallidum. Syphilis is characterized by distinct clinical stages and wide spectrum of manifestations, earning it the nickname the Great Imitator because its signs and symptoms resemble that of many other diseases. If untreated, syphilis progresses through primary, secondary, latent, and tertiary stages, potentially leading to severe cardiovascular, neurological, and multi-system complications years after initial infection. Syphilis is a global public health problem despite the availability of effective diagnostic tools and curative therapy. Its interaction with other sexually transmitted infections, especially the human immunodeficiency virus, contributes immensely to its clinical and epidemiological significance. Congenital syphilis, which is transmitted from infected mother to child, continues to contribute substantially to perinatal morbidity and mortality. Let's talk about the causative agent. The causative agent of syphilis is the spirochete bacterium Treponema pallidum. Treponema pallidum is the causative agent of syphilis. Treponema pallidum is a slender, tightly coiled, spiral-shaped bacterium. It is slender, tightly coiled spirochete bacterium, and just between the peptidoglycan cell wall and the outer membrane, there is the presence of an axial filament or an endoflagella. Just between the outer membrane and the peptidoglycan cell wall, there is the presence of an axial filament or an endoflagella. The presence of the endoflagella facilitates rapid movement of Treponema pallidum, and not just any kind of movement, but a corkscrew-like motility, a corkscrew-like movement. And this movement aids the penetration ability of the bacterium in mucous membrane and in tissues, thereby promoting its pathogenicity. Treponema pallidum is microaerophilic, meaning it thrives in environments with low oxygen. It is also extremely fastidious, and as such, making it almost impossible to culture in artificial laboratory medium. Treponema pallidum lacks many metabolic and biosynthetic pathways, and as such, it relies on the human host for its important nutrients. And this also explains its obligate parasitic nature as well as its limited survival outside the human body. Let's talk about the pathogenesis. Let's briefly talk about the pathogenesis of syphilis. Syphilis is transmitted primarily through direct contact with infectious lesions during sexual activity. It is also transmitted transplacentally from infected mother to fetus. Also, more rarely, it is transmitted through blood transfusion. Infection usually begins when Treponema pallidum, the causative agent, enters the body through microscopic abrasions on the skin and mucous membrane of the genital tract, the oral cavity, as well as the rectum. After penetration, the Causative agent Treponema pallidum multiplies and spreads into the bloodstream as well as via the lymphatic system. This usually occurs before the onset of clinical manifestations. The incubation period of syphilis is about 10 to 90 days. The incubation period of syphilis takes about 10 to 90 days with an average of 3 weeks. Incubation period is the time frame or interval between when an individual gets exposed to an infectious agent and when signs and symptoms of that disease actually commence. So the incubation period of syphilis takes about 10 to 90 days. The initial multiplication of the bacteria in the site of infection leads to the formation of a painless ulcer known as a chancre. The initial multiplication of the bacteria in the site of infection, which can be the genital tract, most times it is the genital tract, but sometimes it can be extragenital sources, especially the oral cavity and the rectum. That initial multiplication leads to the formation of a chancre. A chancre is a painless ulcer that forms in the site of infection, and the formation of a chancre represents the primary stage of syphilis. As the disease progresses, widespread dissemination of the causative agents occurs, and this results in secondary syphilis, which is characterized by systemic involvement and diverse clinical manifestations and features, including skin rashes, mucocutaneous lesions, and generalized lymphadenopathy, especially in the axilla and the groin regions. The host immune system, the human immune system, is able to suppress the disease, but it is not able to completely eradicate it. And this leads to a latent phase with no evident clinical signs and symptoms. The latent phase, that's latent syphilis, may persist for several years. In certain individuals, untreated syphilis can progress into the tertiary stage, tertiary syphilis, which is characterized by severe inflammatory and degenerative lesions, including cardiovascular syphilis, which affects the aorta, as well as neurosyphilis, which affects the central nervous system. It is very important to note that tissue damage that occurs during syphilis is usually immune mediated due to chronic inflammation, basically due to the activities of the host immune system to fighting against the invading bacteria rather than bacteria or direct bacteria toxicity.